Giving birth is hard work for the body, and one of the best ways to recover and help your body transit smoothly into post-pregnancy is by eating a range of varied and nutritious foods. Having a nutritionally balanced diet can help you avoid the discomforts of postpartum constipation, recover from C-section if you had one, as well as make your breast milk as nutritious as possible for your baby. Some mothers choose to follow a confinement diet, while others prefer to return to their pre-pregnancy diet. All options are fine as long as mothers eat smart by having a balanced diet of fruit, vegetables, grains, protein foods and dairy each day. Oily fish like salmon and mackerel is highly recommended because they are also loaded with DHA, which is crucial for your baby's brain development and may even prevent postpartum depression. We come to another important group, which is whole grain carbohydrates. All these helps keep your energy levels up. They also contain important nutrients like folic acid, iron, fiber. Try to choose healthy snacks like cereal bars, yogurt, nuts. All these are what we know as low glycemic index carbohydrates that can provide the body with long-lasting energy. Definitely. Now, breastfeeding requires extra nutrition. Therefore, this makes healthy eating just as important post-pregnancy as well as during pregnancy. Your body is clever at regulating the nutrients in the breast milk. However, if not getting enough nutrients from your diet, your body will then draw from your own stores, leaving you depleted and malnourished. There's also some evidence to show that your breast milk carries the flavors of the foods you eat. The good news is there are no specific foods to avoid, unless you're allergic to certain foods, for example, peanuts. In fact, the latest research suggests that if you eat this food or breastfeeding, as well as introduce them to your infant's diet within his first year, he's less likely to develop a sensitivity to them. Yes, breastfeeding requires extra calories. In fact, the weight you gain from your pregnancy will be stores that are needed to provide the calories for making the milk your baby needs from birth right up to 6 months. If you're not able to consume certain foods, for example, if you're vegetarian, you're vegan, or lactose intolerant, or do not have sufficient exposure to sunshine, you'll find that multivitamins and perhaps even fish oil supplements will benefit you. So it would be good to seek your healthcare professional for further advice on this. Your body needs a lot of fluid, about 6 to 10 glasses a day, to make sufficient milk for your baby. Plain water is the best, although you can vary your options by occasionally having juices or traditionally brewed drinks, for example, red date tea. However, these drinks are often loaded with sugar and are best kept to 1 glass a day. Try to also have at least 2 glasses of milk each day to provide you and your baby with adequate calcium, vitamin D and protein. Do be careful when it comes to caffeinated drinks and alcohol because caffeine can get into your breast milk. Most recommendations advise not having more than 200 to 300 milligrams of caffeine a day, which is approximately 1 to 2 mugs of coffee. However, remember the caffeine can also be found in tea, chocolate, many soft drinks, as well as over-the-counter medication. In terms of alcohol, many breastfeeding mothers choose to stop drinking alcohol. However, occasional light drinking while breastfeeding has not been shown to have any adverse effects on babies. If you do wish to drink, wait 2 to 3 hours for the alcohol to be flushed out of your system before your next breastfeed. Alternatively, you could also express and store the milk before your drink. Importantly, don't forget to exercise after pregnancy because exercise has numerous benefits. It can help you to lose the weight gained from pregnancy, reduces your post-pregnancy constipation, bloating and backaches, and more importantly, it lifts your spirits and actually promote better sleep. Moderate intensity physical activity such as brisk walking, yoga is good for you. Exercise classes are also another fun way to get into shape, and sometimes you can even find a class that will include your baby.